Welcome to Noun Tutorial TV. Like, share and subscribe. NSC202, Human Anatomy 3 Summary. The importance of taste lies in the fact that it allows a person to select in accord with desires food. Is mainly a function of the taste buds in the mouth. Taste. Taste is mainly a function of the in the mouth. Taste buds. Substances called dissolve in saliva. Taste ants. Substances called taste ants dissolve in saliva, enter the taste pores, and by various mechanisms cause the taste cells to depolarize. The binding of taste ants to receptors on the taste hairs activates G proteins. When the taste cells depolarize, they release that diffuse to sensory neurons associated with the taste cells. Neurotransmitters. The stimulate action potentials in the sensory neurons which are conducted to the brain where the sense of taste is perceived. Neurotransmitters. How many primary tastes have been identified in humans? 5. The primary tastes identified in humans include salty, sour, sweet, bitter, umami. Message stands for monosodium glutamate. Sensitivity for bitter substances is the highest. True. Most of the sensations thought of as being tastes are strongly influenced by sensations. Olfactory. Food served at the wrong is perceived as distasteful. Temperature. Food served at the wrong temperature is perceived as distasteful. The taste buds are found on 3 types of papillae of the tongue, as follows. A large number of taste buds are on the walls of the troughs that surround the circumvallate papillae. Moderate numbers of taste buds are on the fungiform papillae over the flat anterior surface of the tongue. Moderate numbers are on the foliate papillae located in the folds along the lateral surfaces of the tongue. Adults have 3,000 to 10,000 taste buds. How many taste buds do adults have? 3,000 to 10,000. Each of the taste buds on a person's tongue consists of 3 major types of specialized epithelial cells. 10,000 each of the 10,000 taste buds on a person's tongue consists of 3 major types of specialized cells. Epithelial. Each of the 10,000 taste buds on a person's tongue consists of major types of specialized epithelial cells. 3. The sensory cells of each taste bud consist of about taste cells. 50. The cells of each taste bud consist of about 50 taste cells. Sensory. The sensory cells of each taste bud consist of about 50 taste cells. Each taste cell has several microvilli, called taste hairs. Each taste cell has several taste hairs extending from its apex into a tiny opening in the epithelium called the taste pore. The remaining 2 nonsensory cell types are basal cells and supporting cells. The cells of the taste buds each have a normal lifespan of about days. 10. The process of choosing certain types of food in preference to others is called taste preference. Taste is mainly a function of the in the mouth. Taste buds. Receptors on the hairs detect taste ants. Simply means that an animal will choose certain types of food in preference to others' taste preference. Consist of taste cells, basilar cells, and supporting cells. Taste buds. Is the least understood of our senses. Smell. Smell is the least understood of our senses. True. A small superior part of the nasal cavity is lined with olfactory epithelium. Million olfactory neurons are present within the olfactory epithelium. 10. Olfactory neurons are neurons with dendrites extending to the epithelial surface of the nasal cavity. Bipolar. Neurons are bipolar neurons with dendrites extending to the epithelial surface of the nasal cavity. Olfactory. Olfactory neurons are bipolar neurons with extending to the epithelial surface of the nasal cavity. Dendrites. Olfactory neurons are bipolar neurons with dendrites extending to the epithelial surface of the nasal cavity. The ends of the dendrites are modified into bulbous enlargements with long specialized cilia called olfactory hairs. Airborne odor ants become dissolved in the mucus on the surface of the epithelium and bind to molecules on the membranes of the olfactory hairs called olfactory receptors. The odor ants must first be dissolved in fluid in order to reach the olfactory receptors. True. When an odorant binds to its receptor, a dash associated with the receptor is activated. G protein. The average person can distinguish among approximately different smells. 4,000. The wide varieties of detectable odors are actually combinations of a smaller number of odors. Primary. Axons from olfactory neurons form the olfactory nerves. Axons from olfactory neurons form the olfactory nerves which pass through the olfactory foramina of the cribriform plate and enter the olfactory bulb. Can produce strong emotional reactions, memories, and other responses. Odors. Within the olfactory bulb and olfactory cortex, occur that tend to inhibit transmission of action potentials resulting from prolonged exposure to a given odorant. Feedback loops. Is a complete loss of smell. Anosmia. Is a partial loss of smell or decreased sensation of smell. Hyposmia. A condition in which there is enhanced smell sensitivity is called hyperosmia. Is distortion in odor perception, includes parosmia and phantasmia. Dysosmia. Is distortion of perception of an external stimulus. Parosmia. Smell perception with no external stimulus. Phantasmia. The organs of hearing and balance are divided into parts. 3. The organs of hearing and balance are divided into 3 parts, the external, middle, and ear. Inner. The ear is the part extending from the outside of the head to the tympanic membrane, or eardrum. External. The external ear is the part extending from the outside of the head to the tympanic membrane. The head to the eardrum is also called tympanic membrane. The is an air-filled chamber medial to the tympanic membrane. Middle ear. The is a set of fluid-filled chambers medial to the middle ear. Inner ear. The external and middle ears are involved in only. Hearing. The fleshy part of the external ear on the outside of the head is called auricle. The auricle opens into the external acoustic meatus, a passageway that leads to the tympanic membrane. The auricle collects sound waves and directs them toward the external acoustic meatus, which transmits them to the tympanic membrane. The is a thin membrane separating the external ear from the middle ear. Tympanic membrane. The middle ear contains auditory ossicles. 3. The middle ear contains 3 auditory ossicles, the malleus, incus, and stapes. The is attached to the medial surface of the tympanic membrane. Malleus. The muscle is attached to the malleus and is innervat by the trigeminal nerve, v. Tensor tympani. The S muscle is attached to the stapes and is innervat by the facial nerve, 7. Stapedius. Distortion of the membrane can make sounds seem muffled and stimulate pain. Tympanic. Swallowing, yawning, chewing, and holding the nose and mouth shut while gently trying to force air out of the lungs are methods used to open the auditory tube. The contains the sensory organs for hearing and balance. Inner ear. The inner ear contains the sensory organs for hearing and balance. The consists of interconnecting, fluid-filled tunnels and chambers within the temporal bone called the bony labyrinth. Inner ear. The inner ear consists of interconnecting, fluid-filled tunnels and chambers within the temporal bone called the bony labyrinth. The bony labyrinth is lined with endosteum. The auditory tube is also called the pharyngotympanic tube or eustachian tube. The auditory tube opens into the dash and enables air pressure to be equalized between the outside ear and the middle ear cavity. Pharynx. The dash opens into the pharynx and enables air pressure to be equalized between the outside ear and the middle ear cavity. Auditory tube. The distortion of the tympanic membrane can make sounds seem muffled and stimulate pain. True. The dash or loudness of sound is a function of wave amplitude, or height, measured in decibels. Volume. The volume, or loudness, of sound is a function of wave amplitude, or height, measured in decibels. The dash of sound is a function of the wave frequency. Pitch. Pitch is measured in hertz. The higher the frequency is, the higher the pitch. True. The normal range of human hearing is 20 to 20,000 Hz and 0 or more decibels, dB. Sounds louder than dB are painful to the ear. 125 timbre is the resonance quality or overtones of a sound. The dash collects sound waves and directs them into the external acoustic meatus. Auricle. The auricle collects sound waves and directs them into the external acoustic meatus. Sound waves travel relatively slowly in air-m/s332. The oval window is approximately times smaller than the tympanic membrane. 20. The dash and stapedius muscles are attached to auditory ossicles. Tensor tympani. The dash and dash are attached to auditory ossicles. Tensor tympani and stapedius muscles. The tensor tympani and stapedius muscles are attached to dash ossicles. Auditory. The sound attenuation reflex responds most effectively to low-frequency sounds and can reduce by a factor of 100 the energy reaching the oval window. The dash interprets the higher frequency of action potentials as a louder sound. Brain. The brain interprets the higher frequency of action potentials as a dash sound. Louder. Of the inner hair cells by the nervous system stimulates the contraction of actin filaments within the hair cells, causing them to shorten. Stimulation. Stimulation of the inner hair cells by the nervous system stimulates the contraction of within the hair cells, causing them to shorten. Actin filaments. The basilar membrane is not uniform throughout its length. True. The dash interprets the higher frequency of action potentials as a louder sound. Brain. The brain interprets the higher dash of action potentials as a louder sound. Frequency. The brain interprets the higher frequency of action potentials as a dash sound. Louder. Dash of the inner hair cells by the nervous system stimulates the contraction of actin filaments within the hair cells, causing them to shorten. Stimulation. The cochlear nerve joins the vestibular nerve to become the, which traverses the internal acoustic meatus and enters the cranial cavity. Vestibulocochlear nerve, 8. The dash joins the vestibular nerve to become the vestibulocochlear nerve, 8, which traverses the internal acoustic meatus and enters the cranial cavity. Cochlear nerve. The term dash refers to the vestibule of the inner ear, which is involved in balance. Vestibular. The term dash refers to the cochlea of the inner ear, which is involved in hearing. Cochlear. The dash functions as two separate nerves carrying information from two separate but closely related structures. Vestibulocochlear nerve. Dash is a complex process not simply confined to one type of input. Balance. A dash pathway allows the maintenance of visual fixation on an object while the head is in motion. Reflex. A slight oscillatory movement of the eyes, called dash, occurs. Nystagmus. The sense of balance, or equilibrium, has two components, dash and dash dash. Static balance and dynamic balance. Dash is associated with the vestibule and is involved in evaluating the position of the head relative to gravity. Static balance. Dash is associated with the semicircular canals and is involved in evaluating changes in the direction and rate of head movements. Dynamic balance. Static balance is associated with the utricle and the dash of the vestibule. Saccule. Static balance is associated with the dash and the saccule of the vestibule. Utricle. Static balance is associated with the utricle and the saccule of the dash. Vestibule. The hairs of the hair cells consist of numerous microvilli, called, and one cilium, called a kinocilium. Stereocilia. The hairs of the hair cells consist of numerous microvilli, called stereocilia, and one cilium, called a dash. Kinocilium. The stereocilia and kinocilium are embedded in the dash, which is a gelatinous mass weighted with crystals of calcium carbonate and protein called otoliths. Otolithic membrane. The stereocilia and kinocilium are embedded in the otolithic membrane, which is a gelatinous mass weighted with crystals of calcium carbonate and protein called dash. Otoliths. Dash of the hairs toward the kinocilium results in depolarization of the hair cell. Deflection. Deflection of the hairs toward the dash results in depolarization of the hair cell. Kinocilium. Deflection of the dash toward the kinocilium results in depolarization of the hair cell. Hairs. Deflection of the hairs toward the kinocilium results in dash of the hair cell. Depolarization. Deflection of the hairs toward the kinocilium results in depolarization of the dash. Hair cell. There are dash semicircular canals placed at nearly right angles to one another. 3. Rupture of the tympanic membrane may result in dash. Hearing impairment. Rupture of the dash may result in hearing impairment. Tympanic membrane. The dash is a branch of the facial nerve carrying taste impulses from the anterior two otiards of the tongue. Chorda tympani. The range of normal human speech is dash. 250 to 8000 Hz. Prolonged or frequent exposures to excessively loud noises can cause dash. Degeneration of the spiral organ at the base of the cochlea, resulting in high-frequency deafness. Dash is the most common disease involving dizziness from the inner ear. Meniere's disease. The eyeball is composed of dash layers. 3. The fibrous layer consists of the sclera and cornea, the dash consists of the choroid, ciliary body, and iris. Vascular layer. The fibrous layer consists of the sclera and cornea, the vascular layer consists of the ciliary body, and iris. Choroid. The fibrous layer consists of the sclera and cornea, the vascular layer consists of the choroid, body, and iris. Ciliary body. The fibrous layer consists of the sclera and cornea, the vascular layer consists of the choroid, ciliary body, and dash. Iris. The dash is the firm, opaque, white, outer layer of the posterior 5/6 of the eyeball. Sclera. The dash helps maintain the shape of the eyeball, protects its internal structures, and provides an attachment point for the extrinsic eye muscles. Sclera. The sclera is continuous with the dash, the anterior sixth of the eyeball. Cornea. The dash consists of a connective tissue matrix containing collagen, elastic fibers, and proteoglycans, with a layer of stratified squamous epithelium covering the outer surface and a layer of simple squamous epithelium on the inner surface. Cornea. The dash of the eye is so named because it contains most of the blood vessels of the eye. Vascular layer. The posterior portion of the vascular layer, associated with the sclera, is the dash. Choroid. The dash is continuous anteriorly with the ciliary body, which consists of an outer ciliary ring and an inner group of ciliary processes. Choroid. The ciliary ring and the base of the ciliary processes contain smooth muscle called ciliary muscles. Dash attach the ciliary ring and processes to the lens of the eye, and contraction of the ciliary muscles can change the shape of the lens. Suspensory ligaments. Dash enters the eye through the pupil. Light. Light enters the eye through the dash. Pupil. The dash regulates the amount of light by controlling the size of the pupil. Iris. The iris contains dash groups of smooth muscles. 2. The iris contains two groups of smooth muscles, a circular group called the dash and a radial group called the dilator pupillae. Sphincter pupillae. The iris contains two groups of smooth muscles, dash dash. Sphincter pupillae and dilator pupillae. The iris contains two groups of smooth muscles, a circular group called the sphincter pupillae and a radial group called the dash dash. Dilator pupillae. The dash are innervat by parasympathetic fibers from the oculomotor nerve. 3. Sphincter papillae. The sphincter papillae are innervat by dash from the oculomotor nerve. 3. Parasympathetic fibers. The sphincter papillae are innervat by parasympathetic fibers from the dash dash. Oculomotor nerve. 3. The color of the eye differs from person to person. True. A large amount of dash in the iris causes it to appear brown or even black. Melanin. Less melanin results in dash dash. Light brown, green, or gray irises. The dash is the inner layer of the eye, covering the inner surface of the eye posterior to the ciliary body. Retina. The retina has over dash photoreceptor cells which respond to light. 126 million. In the center of the macula is a small pit, the dash centralis. Fovea. The dash dash, followed by the macula, has the highest concentration of photoreceptor cells in the retina. Fovea. The interior of the eye is divided into three chambers dash dash dash, posterior chamber, and vitreous chamber. Anterior chamber. The interior of the eye is divided into three chambers, anterior chamber, dash dash, and vitreous chamber. Posterior chamber. The interior of the eye is divided into three chambers, anterior chamber, posterior chamber, and vitreous chamber. The interior of the eye is divided into dash chambers. 3. A fluid called dash fills the anterior and posterior chambers. Aqueous humor. Dash helps maintain intraocular pressure, which keeps the eyeball inflated and is largely responsible for maintaining the shape of the eyeball. Aqueous humor. Aqueous humor is produced by the ciliary processes as a blood filtrate and is returned to the circulation through a venous ring called the dash dash. Scleral venous sinus. Dash is an abnormal increase in intraocular pressure that results when the rate of production of aqueous humor exceeds its rate of removal. Glaucoma. A transparent, jelly-like substance called dash fills the vitreous chamber. Vitreous humor. The dash is an avascular, transparent, biconvex disc located behind the pupil. Lens. Dash means that each side of the lens bulges outward. Biconvex. The lens consists of a layer of cuboidal epithelial cells on its anterior surface and a posterior region of very long, columnar epithelial cells called dash dash. Lens fibers. The lens fibers lose their nuclei and other cellular organelles and accumulate a set of proteins called dash dash. Crystalline. The dash are curved lines of hair over the orbit. Eyebrows. The dash are movable folds covering the anterior surface of the eye when closed. Eyelids. The medial angle contains a small, reddish-pink mound called the dash dash. Caruncle. The eyelids consist of dash layers of tissue. 5. A crescent-shaped layer of dense connective tissue called the dash dash. Tarsal plate. Dash are attached as a double or triple row of hairs to the free edges of the eyelids. Eyelashes. Dash are modified sweat glands that open into the hair follicles of the eyelashes to keep them lubricated. Ciliary glands. An infection or a blockage of a tarsal gland is called a dash dash. Chalazion or meibomian cyst. The dash is a thin, transparent mucous membrane. Conjunctiva. The dash consists of a lacrimal gland, lacrimal canaliculi, and a nasolacrimal duct. Lacrimal apparatus. The dash is in the superolateral corner of the orbit and is innervat by parasympathetic fibers from the facial nerve. 7. Lacrimal gland. Most of the fluid produced by the lacrimal glands evaporates from the surface of the eye, but excess tears are collected in the medial corner of the eye by small tubes called the dash dash. Lacrimal canaliculi. The lacrimal canaliculi connect to the dash dash, which opens into the inferior meatus of the nasal cavity beneath the inferior nasal concha. Nasolacrimal duct. The dash attach to the outside of the eyeball and cause it to move. Extrinsic eye muscles. There are dash rectus muscles. 4. There are 4 rectus muscles dash dash. The superior, inferior, medial, and lateral rectus muscles. Dash means straight, and the fibers of these muscles are nearly straight with the anterior-posterior axis of the eyeball. Rectus. There are dash oblique muscles. 2. There are 2 oblique muscles dash dash. The superior and inferior oblique muscles. The movements of the eye can be described graphically by a figure resembling the letter H. The clinical test for normal eye movement is therefore called the dash dash. H test. The dash is the entire range of wavelengths, or frequencies, of electromagnetic radiation. Electromagnetic spectrum. Dash is the portion of the electromagnetic spectrum that can be detected by the human eye is a small part of the electromagnetic spectrum. Visible light. The bending of light is called dash dash. Refraction. The greater the curvature of the surface, the greater is the dash of light. Refraction. The greater the curvature of the surface, the greater is the refraction of light. True. The greater the curvature of the surface, the greater is the refraction of dash dash. Light. As light rays converge, they finally reach a point at which they cross. This point is called the, and causing light to converge is called focusing. Focal point, FP. If light rays strike an object that is not transparent, they bounce off the surface. This phenomenon is called dash dash. Reflection. The eye is optically equivalent to the usual dash dash. Photographic camera. The dash is optically equivalent to the usual photographic camera. Eye. The lens system of the eye is composed of 4 refractive interfaces. 1. The interface between air and the anterior surface of the cornea. 2. The interface between the posterior surface of the cornea and the aqueous humor. 3. The interface between the aqueous humor and the anterior surface of the lens of the eye. And 4. The interface between the posterior surface of the lens and the vitreous humor. The dash dash comma, which refracts light, is the cornea, aqueous humor, lens, and vitreous humor. Focusing system of the eye. The dash are the most important elements of the focusing system of the eye. Cornea and lens. The dash is responsible for most of the refraction of light. Cornea. The cornea is responsible for most of the refraction of light because dash dash. The greatest contrast in media density is between the ear and the cornea. Dash occurs when looking at objects 20 feet or more from the eye. Distant vision. Dash occurs when looking at objects that are less than 20 feet from the eye. Near vision. The condition in which the lens is flattened so that nearly parallel rays from a distant object are focused on the retina is referred to as dash dash. Emetropia. The point at which the lens does not have to thicken for focusing to occur is called the dash and normally is 20 feet or more from the eye. Far point of vision. 3 events occur to bring the image into focus on the retina, dash dash. Accommodation by the lens, constriction of the pupil, and convergence of the eyes. Dash events occur to bring the image into focus on the retina. 3. The more spherical lens has a more convex surface, causing greater refraction of light, which brings the image back into focus on the retina. This process is called dash dash. Accommodation. The point at which this blurring occurs is called the dash dash. Near point of vision. The increase in the near point of vision is called dash dash. Presbyopia. The is the greatest distances through which an object can be moved and still remain in focus on the retina. Depth of focus. The main factor affecting depth of focus is the dash dash. Size of the pupil. When the dash is constricted, the light entering the eye tends to pass more nearly through the center of the lens and is more accurately focused than light passing through the edges of the lens. Pupil. When the pupil is constricted, the light entering the eye tends to pass more nearly through the dash of the lens and is more accurately focused than light passing through the edges of the lens. Center. When the pupil is constricted dash dash, the light entering the eye tends to pass more nearly through the center of the lens and is more accurately focused than light passing through the edges of the lens. Pupillary diameter also regulates the amount of light entering the eye. True. The medial rotation of the eyes is accomplished by a reflex that stimulates the medial rectus muscle of each eye. This movement of the eyes is called dash dash. Convergence. The dash contains 3 layers of neurons: photoreceptor, bipolar, and ganglionic. Neural layer. The neural layer contains 3 layers of neurons, dash dash, bipolar, and ganglionic. Photoreceptor. The neural layer contains 3 layers of neurons, photoreceptor, dash dash, and ganglionic. Bipolar. The neural layer contains 3 layers of neurons, photoreceptor, bipolar, and dash dash. Ganglionic. The photoreceptor layer contains dash dash, which are the photoreceptor cells that respond to light. Rods and cones. The dash consists of retinal pigment epithelium, RPE, a single layer of cuboidal epithelial cells filled with melanin. Pigmented layer. The pigmented layer consists of dash a single layer of cuboidal epithelial cells filled with melanin. Retinal pigment epithelium, RPE. Dash are responsible for non-color vision and vision under conditions of reduced light. Rods. Dash are bipolar neurons with modified, light-sensitive dendrites, which are cylindrical in shape. Rods. Dash are responsible for color vision and visual acuity. Cones. Dash is a function of the wavelength of light. Color. The fovea centralis has approximately dash cones and no rods. 35,000. The rest of the macula has more cones than rods. True. Dash in the outer plexiform layer synapse with photoreceptor cells and bipolar cells. Horizontal cells. Dash in the inner plexiform layer synapse with bipolar and ganglion cells. Amacrine cells. Dash connect cells in the outer and inner plexiform layers, forming feedback loops interplexiform cells. Just anterior to the pituitary gland, the optic nerves are connected to each other at the dash dash. Optic chiasm. The image seen by each eye is the dash of that eye. Visual field. Dash is the ability to see close objects clearly while distant objects appear blurry. Myopia or short-sightedness. Dash is a defect of the eye in which the focusing system, the cornea and lens, is optically too powerful, or the eyeball is too long. Myopia. Myopia is corrected by a dash that spreads out the light rays coming to the eye so that, when the light is focused by the eye, it is focused on the retina. Concave lens. Myopia is corrected by a concave lens called lenses. Minus. Dash is the ability to see distant objects clearly while close objects appear blurry. Hypermetropia, or long-sightedness. Dash is a disorder in which the cornea and lens system is optically too weak or the eyeball is too short. Hypermetropia. Hypermetropia is corrected by a dash that causes light rays to converge as they approach the eye and to focus on the retina. Such lenses are called plus lenses. Convex lens. Hypermetropia is corrected by a convex lens that causes light rays to converge as they approach the eye and to focus on the retina. Such lenses are called dash lenses. Plus. Dash is the normal, presently unavoidable degeneration of the accommodation power of the eye that occurs as a consequence of aging. Presbyopia. Dash occurs because the lens becomes hard and less flexible. Presbyopia. Dash is a defect in which the cornea or lens is not uniformly curved and the image is not sharply focused. Astigmatism. Dash results from loss of rod function. Night blindness. Night blindness results from loss of dash dash. Rod function. Temporary night blindness can result from A- deficiency because vitamin A is necessary to produce retinol. Vitamin A- is a condition involving excessive pressure build-up in the aqueous humor. Glaucoma. Results from an interference with normal re-entry of aqueous humor into the blood or from an overproduction of aqueous humor. Glaucoma. Structures of the eye are the eyebrows, the eyelids, the conjunctiva and lacrimal glands. Accessory. Accessory structures of the eye are the eyebrows, the eyelids, the conjunctiva and lacrimal glands. The is composed of endocrine glands, which are ductless glands secreting chemical messengers into the circulatory system. Endocrine system. The endocrine system is composed of which are ductless glands secreting chemical messengers into the circulatory system. Endocrine glands. The term endocrine is derived from the Greek words endo, meaning within, and krino, to separate. The chemical messengers secreted by endocrine glands are called hormones, a term derived from the Greek word hormone, meaning to set into motion. The main regulatory functions of the endocrine system are the following: 1. Metabolism and tissue maturation. 2. Ion regulation. 3. Water balance. 4. Immune system regulation. 5. Heart rate and blood pressure regulation. 6. Control of blood glucose and other nutrients. 7. Control of reproductive functions. 8. Uterine contractions and milk release. Can be defined as chemicals secreted by a cell that affect the functions of other cells. Hormones. The target cells of a hormone are the cells that contain the for the hormone. Receptors. Steroids are soluble in lipids. True. Examples of steroid hormones are estrogen, progesterone, testosterone, cortisol. Hormones are those that are made of amino acids or proteins. Non-steroid. The hormone receptor complex in the membrane usually activates a G protein. The causes enzymes inside the cell to be turned on. G protein. Are local hormones. Prostaglandins. Hormones bind to proteins or glycoproteins called receptors. The portion of each protein or glycoprotein molecule where a hormone bind is called a receptor site or binding site. The tendency for each type of chemical messenger to bind to a specific type of receptor, and not to others, is called specificity. Hormones are secreted and distributed throughout the body by the circulatory system. TSH means thyroid stimulating hormone. A drug that binds to a hormone receptor and activates it is called an for that hormone. Agonist. A drug that binds to a hormone receptor and inhibits its action is called an for that hormone. Antagonist. The pituitary gland is located at the base of the brain and is controlled by the hypothalamus. This gland is well protected by a bony structure called the sella turcica. The of the brain and the pituitary gland are major sites where the nervous and endocrine systems interact. Hypothalamus. The pituitary gland is roughly 1 cm in diameter, weighs 0.5 to 1.0 g, and rests in the sella turcica of the sphenoid bone. It is located inferior to the hypothalamus and is connected to it by a stalk of tissue called the infundibulum. The posterior pituitary is also called neurohypophysis. The is one of two major portal systems. Hypothalamo-hypophyseal portal system. There is no portal system to carry hypothalamic hormones to the posterior pituitary. True. The axons of the cells extend from the hypothalamus through the infundibulum into the posterior pituitary and form a nerve tract called the hypothalamo-hypophyseal tract. The stores and secretes two polypeptide hormones called antidiuretic hormone and oxytocin. Posterior pituitary. The posterior pituitary stores and secretes two polypeptide hormones called antidiuretic hormone and oxytocin. Is so named because it prevents the output of large amounts of urine, diuresis. Antidiuretic hormone, ADH. ADH can also cause blood vessels to constrict when released in large amounts. Consequently, it is sometimes called vasopressin. Binds to membrane-bound receptors and causes contraction of the smooth muscle cells of the uterus and milk ejection, or milk let down from the breasts in lactating women. Oxytocin. The receives signals from many sources in the nervous system. Hypothalamus. Stimulates the growth of most tissues and, through its effect on the epiphyseal plates of bones, GH plays a role in determining how tall a person becomes. Growth hormone, GH. The best known somatomedin are two polypeptide hormones produced by the liver called insulin-like growth factor IN2. Is a condition of abnormally increased height that usually results from excessive cartilage and bone formation at the epiphyseal plates of long bones. Gigantism. The most common type of gigantism, results from excess secretion of GH. The large stature of some individuals. Pituitary gigantism. Is caused by excess GH secretion in adults, and many pituitary giants develop acromegaly later in life. Acromegaly. Is the condition in which a person is abnormally short, is the opposite of gigantism. Dwarfism. Results when abnormally low levels of GH affect the whole body. Pituitary dwarfism. Is the most common type of dwarfism. Achondroplasia, or achondroplastic dwarfism. The secretes at least 9 hormones that regulate numerous body functions and other endocrine glands. Pituitary gland. Promotes water retention by the kidneys. Antidiuretic hormone, ADH. Antidiuretic hormone, ADH, promotes water retention by the kidneys. Stimulates growth in most tissues and is a regulator of metabolism. Growth hormone, GH. The consists of 2 lobes connected by a narrow band called the isthmus. Thyroid gland. The thyroid gland consists of 2 lobes connected by a narrow band called the isthmus. The thyroid gland contains numerous, which are small spheres whose walls are composed of a single layer of cuboidal epithelial cells. Follicles. Each thyroid follicle is filled with proteins, called which are synthesized and secreted by the cells of the thyroid follicles. Thyroglobulin. Is secreted from the parafollicular cells and plays a role in reducing the concentration of Ca2+ in the body fluids when Ca2+ levels become elevated. Calcitonin. The thyroid hormones are triiodothyronine, T3, and tetraiodothyronine, T4. Another name for T4 is thyroxine. From the anterior pituitary stimulates thyroid hormone synthesis and secretion. Thyroid stimulating hormone, TSH. Releasing hormone, TRH, is produced in the hypothalamus. Thyrotropin. Thyrotropin releasing hormone, TRH, is produced in the hypothalamus. Chronic exposure to cold increases TRH secretion. True. Stress, such as starvation, injury, and infections, decreases TRH secretion. True. In addition to secreting thyroid hormones, the thyroid gland secretes a hormone called produced by the parafollicular cells. Calcitonin. Calcitonin secretion is directly regulated by blood levels. Ca2+. The role of in humans is unclear. Calcitonin. The role of calcitonin in humans is unclear. True. Helps prevent elevated blood Ca2+ levels, but a lack of calcitonin secretion does not result in a prolonged increase in blood Ca2+ levels. Calcitonin. The dash are usually embedded in the posterior part of each lobe of the thyroid gland. Parathyroid glands. The parathyroid glands secrete a polypeptide hormone called DASH, which is essential for the regulation of blood Ca2+ levels. Parathyroid hormone, PTH. DASH is reduced or no secretion of thyroid hormones. Hypothyroidism. Damage to the pituitary gland can result in DASH. Decreased TSH secretion. Lack of iodine in the diet can result in DASH. Decreased thyroid hormone. Lack of iodine in the diet can result in decreased thyroid hormone levels because iodine is necessary for the synthesis of thyroid hormones. Dash of thyroid hormones decreases the rate of metabolism. Hyposecretion. Hyposecretion of thyroid hormones decreases the rate of metabolism. DASH is an abnormally increased secretion of thyroid hormones. Hyperthyroidism. After diabetes mellitus, the most common endocrine disorder is a type of hyperthyroidism called Graves' disease. DASH is a chronic enlargement of the thyroid gland not due to a tumor. Goiter. The adrenal medulla is the central portion of the gland and secretes epinephrine and norepinephrine. The adrenal cortex secretes hormone types. 3. The adrenal cortex secretes 3 hormone types, glucocorticoids, and androgens. Mineralocorticoids. The adrenal cortex secretes 3 hormone types, mineralocorticoids, and androgens. Glucocorticoids. The adrenal cortex secretes 3 hormone types, mineralocorticoids, glucocorticoids, and androgens. The major glucocorticoid is cortisol. The 2 major types of responses to glucocorticoids are classified as metabolic and anti-inflammatory. Decrease the intensity of the inflammatory and immune responses by decreasing both the number of white blood cells and the secretion of inflammatory chemicals from tissues. Glucocorticoids. Increases the breakdown of protein and fat and increases their conversion to forms that can be used as energy sources by the body. Cortisol. A steroid closely related to cortisol, is often given as a medication to reduce inflammation that occurs in response to injuries. Cortisone. The 2 major disorders of the adrenal medulla are both tumors. Is a benign tumor. Pheochromocytoma. Pheochromocytoma is a tumor. Benign. Neuroblastoma is a tumor. Malignant. Is a malignant tumor. Neuroblastoma. Chronic adrenocortical insufficiency is often called Addison disease. Is caused by an excess production of aldosterone. Aldosteronism. Is a disorder characterized by the hypersecretion of cortisol and androgens and possibly by excess aldosterone production. Cushing's syndrome. The is located behind the stomach. Pancreas. The pancreas is located the stomach. Behind. The pancreas is located behind the stomach. Promotes the uptake of glucose by cells. Insulin. Insulin promotes the uptake of by cells. Glucose. Insulin promotes the uptake of glucose by cells. Increases glucose concentrations in the bloodstream and slows down protein synthesis. Glucagon. The is a collection of neurons in the hypothalamus that controls appetite. Satiety center. Glucose molecules that are not immediately used as an energy source are stored as in the liver, skeletal muscle, and other tissues, or they are converted to fat in adipose tissue. Glycogen. Is broken down to glucose. Glycogen. Glycogen is broken down to glucose. When insulin levels decrease, the liver uses fatty acids to make acetoacetic acid, which is converted to acetone and beta-hydroxybutyric acid. These 3 substances collectively are referred to as Ketone bodies. Dash increases blood sugar and ketone levels. Glucagon. Dash results from the inadequate secretion of insulin or the inability of tissues to respond to insulin. Diabetes mellitus. The two major types of diabetes are Type 1 and Type 2 diabetes. Type 1 diabetes mellitus is also called insulin-dependent diabetes mellitus, IDDM. Type 2 diabetes mellitus is also called non-insulin dependent diabetes mellitus, NIDDM. Three potentially life-threatening conditions are associated with untreated diabetes mellitus. Diabetic ketoacidosis. Hyperglycemic hyperosmolar state. Insulin shock. Dash is used for energy, stored as glycogen, or converted into fats. Glucose. Dash are used to synthesize proteins. Amino acids. Amino acids are used to synthesize proteins. Low levels of dash promote the formation of ketone bodies by the liver. Insulin. Glucagon's target tissue is mainly the liver. Dash causes the breakdown of glycogen to glucose and the synthesis of glucose from amino acids. Glucagon. The dash releases glucose into the blood. Liver. The liver releases dash into the blood. Glucose. The liver releases glucose into the blood. The dash is a small, pinecone-shaped structure located superior and posterior to the thalamus of the brain. Pineal gland. The pineal gland produces a hormone called which inhibits the functions of the reproductive system in some animals. Melatonin. Melatonin is sometimes called the hormone of darkness. Melatonin is sometimes called the hormone of darkness because its production increases in the dark. The thymus is in the neck and superior to the heart in the thorax. It secretes a hormone called thymosin. Are released from the gastrointestinal tract. Cholecystokinin. Cholecystokinin is released from the gastrointestinal tract. Examples of autocrine chemical messengers include a group of related chemical mediators called which are derived from fatty acids. Eicosanoids. Are chemicals released by a cell that affect nearby cells of a different cell type. Paracrine chemical messengers. Examples of paracrine chemical messengers include growth factors, clotting factors, and histamine. The helps keep body temperature at a constant level by controlling the activity of sweat glands and the amount of blood flowing through the skin. Autonomic nervous system, ANS. The consists of the brain and spinal cord. The peripheral nervous system, PNS, consists of sensory receptors and nerves outside the CNS. Central nervous system, CNS. Is the caudal portion of the rhombencephalon. Myelencephalon. Is the absence of a major portion of the brain, skull, and scalp that occurs during embryonic anencephaly. The is the part of the brain that most people think of when the term brain is mentioned. Cerebrum. The is divided into left and right hemispheres by a longitudinal fissure. Cerebrum. The is the most prominent commissural fibers collection. Corpus callosum. A is a localized mass of blood released from blood vessels but confined within an organ or a space. Hematoma. The consists of the medulla oblongata, pons, and midbrain. Brainstem. The is a structural connection between the diencephalon and the spinal cord. Brainstem. Is the shortest part of the brainstem measuring about 2 cm midbrain. Is the portion of the brainstem that connects the pons to the spinal cord. Medulla oblongata. Is a neurological syndrome characterized by tremor, hypokinesia, rigidity, and postural instability. Parkinsonism. Is the largest of the cellular aggregate of the forebrain. Thalamus. Consists of the caudate nucleus, lentiform nucleus, amygdaloid body, and claustrum. Basal ganglia. Dash is a comma-shaped structure with a demonstrable bulbous head, body, and tail attached to the amygdaloid body. Caudate nucleus. Dash is a group of gray matter at the tip of the tail of the caudate nucleus. Amygdaloid body. The dash is a saucer-shaped thin lamina of gray matter, lateral to the putamen. Claustrum. Dash is a neurodegenerative genetic disorder that affects muscle coordination and leads to cognitive decline and behavioral symptoms. Huntington's disease. The dash is located between the brainstem and the cerebrum diencephalon. The diencephalon consists of the dash, subthalamus, epithalamus, and hypothalamus. Thalamus. The diencephalon consists of the thalamus, epithalamus, and hypothalamus. Subthalamus. The diencephalon consists of the thalamus, subthalamus, and hypothalamus. Epithalamus. The diencephalon consists of the thalamus, subthalamus, epithalamus, and hypothalamus. The dash consists of the thalamus, subthalamus, epithalamus, and hypothalamus. Diencephalon. Dash is a C-shaped continuous cavity within the cerebral hemisphere. Lateral ventricle. Dash is triangular in outline with the apex pointing laterally. Anterior horn. Dash is the largest part of the ventricles. Inferior horn. The dash form the floor of the horn. Hippocampus, medial, and the collateral eminence, lateral. Dash is a slit-like space beneath the fornix and corpus callosum. Third ventricle. Dash is produced by a modified ependymal cells and choroid plexus which is found in most part of the ventricular system. Cerebrospinal fluid. Dash is a sterile procedure done to withdraw CSF from the spinal subarachnoid space and must be performed well clear of the termination of the cord. Lumbar puncture. The dash in the inferior cervical region is where spinal nerves supplying the upper limbs originate. Cervical enlargement. The numerous roots, origins, of these nerves resemble the hairs in a horse's tail and are therefore called the dash. Cauda equine. The dash is a long cylindrical structure with flattened anterior-posterior surfaces. Spinal cord. The spinal cord and brain are surrounded by connective tissue membranes called dash. Meninges. The most superficial and thickest membrane is the dash. Dura mater. The dura mater forms a sac, often called the dash, which surrounds the spinal cord. Thecal sac. A dash is the removal of CSF from the subarachnoid space. Spinal tap. The spinal cord gives rise to dash pairs of spinal nerves. 3. The parasympathetic division is sometimes called the dash. Craniosacral division. The sympathetic division is sometimes called the dash. Thoracolumbar division. The first neurons of the series are called dash. Preganglionic neurons. The thenar muscles, innervat by the median nerve, have reduced function, resulting in weakness in thumb flexion and opposition. This condition is referred to as dash. Carpal tunnel syndrome. The dash is a very small plexus formed from the ventral rami of spinal nerve S5 and the coccygeal nerve, co. Coccygeal plexus. The dash is a relatively small plexus originating from spinal nerve C1, C4. Cervical plexus. A dash is the area of skin supplied with sensory innervation by a pair of spinal nerves. Dermatome. A dash shows the distribution of all the derm atoms. Dermatomal map. Trigeminal neuralgia is also called dash. Tic douloureux. Dash means 3 twins. Trigeminal. Trigeminal means dash. 3 twins. Dash nerves carry smell information to the brain for interpretation. Olfactory. Dash carry visual information to the brain for interpretation. Optic nerves. Dash are found within the muscles that move the eyeball, eyelid, and iris. Oculomotor nerves. Dash act in the muscles that move the eyeball. Trochlear nerves. Dash carry sensory information from the surface of the eye, the scalp, facial skin, the lining of the gums, and the palate to the brain for interpretation. Trigeminal nerves. Act in the muscles that move the eyeball. Abducens nerves. Are found in the muscles of facial expression as well as in the salivary and tear glands. Facial nerves. Carry hearing and equilibrium information from the inner ear to the brain for interpretation. Vestibulocochlear nerves. Carry sensory information from the throat and tongue to the brain for interpretation. Glossopharyngeal nerves. Carry sensory information from the thoracic and abdominal organs to the brain for interpretation. Vagus nerves. Are found within the muscles of the throat, neck, back, and voice box. Accessory nerves. Are found within the muscles of the tongue. Hypoglossal nerves. The largest number of taste buds are found in which papillae? Circumvallate. Adult humans have a maximum of about how many taste buds? 10,000. Concerning human smell sensation, which of the following statement is false? Highly developed in humans compared to lower animals. Which type of neurons within the olfactory epithelium? Bipolar. Influx of ions into olfactory hairs is triggered by the activation of G protein. Olfactory nerves are formed by axons of olfactory neurons. Apart from olfactory cortex, olfactory tracts terminate in what other region of the brain? Amygdala. The external ear is separated from the middle ear by tympanic membrane. The part of external ear outside the head is called auricle. The auditory ossicles are malleus, incus, and stapes. The muscles of the middle ear are tensor tympani and stapedius. The stapedius muscle is innervated by which nerve? Facial. Which of the fluids in the inner ear is similar to cerebrospinal fluid? Perilymph. The structure of cochlea gives a resemblance to snail. Which part of cranial nerve 8 is responsible for balancing? Vestibular. Arrange the layers of the eye from superficial to deep fibrous layer, vascular layer, retina. The bony labyrinth is filled with which fluid? Perilymph. The embryonic beginning of the brain and spinal cord is the neural tube. Connective tissue fibers found in the sclera are collagen and elastic. The part of embryonic brain that forms the cerebral cortex is telencephalon. The inner surface of cornea is covered by simple squamous epithelium. Spinal bifida is a failure of closure of the neural tube. The rhombencephalon give rise to which of these regions? Medulla. Orbicularis oculi is responsible for closing eyes. The most obvious features of the cerebrum are gyri and sulci. The pituitary gland is divided into how many lobes? 2. The two hemispheres of the brain are connected by corpus callosum. Which type of epithelia lines the follicles of the thyroid gland? Simple cuboidal. The bone which houses the pituitary gland ABCD? Sphenoid bone. Histologically, the cerebral cortex is arranged in how many layers? 6. The pituitary gland is connected to the what part of the brain? Hypothalamus. Which of this part of the midbrain is particularly implicated in Parkinson's disease? Substantia nigra. Which brain ventricles is housed within the cerebral hemispheres? Lateral. The lateral ventricles in the cerebrum are connected to the third ventricle in the diencephalon by interventricular foramina. Approximately 80% of the hormone released from the adrenal medulla is adrenaline. Which of these does not partake in the cerebral arterial circle of Willis? Basilar artery. Photoreceptors are mostly concentrated in what part of the retina? Fovea. A defect in which the cornea or lens is not uniformly curved and the image is not sharply focused is called astigmatism. Taste is mainly a function of the taste in the mouth. buds. Substances called dissolve in saliva, enter the taste pores, and by various mechanisms cause the taste cells to depolarize. Taste ants. Many of the sensations thought of as being taste are strongly influenced by sensations. Olfactory. Beyond the age of years, many taste buds degenerate, causing taste sensitivity to decrease in old age. 45. Each taste cell has several microvilli, called taste hairs. Airborne odor ants become dissolved in the mucus on the surface of the epithelium and bind to molecules on the membranes of the olfactory hairs called olfactory receptors. The olfactory cortex is part of the projecting to the hypothalamus, amygdala, and hippocampus of the cerebrum. Limbic system. Is partial loss of smell or decreased sensation of smell. Hyposmia. The membranous labyrinth is filled with a clear fluid called endolymph. In the inner ear, the hair cells consist of numerous microvilli, called stereocilia, and one cilium, called a kinocilium. The eye consists of the eyeball, or globe of the eye, and the nerve. Optic. The is avascular and transparent, permitting light to enter the eye. Cornea. The iris regulates the amount of light by controlling the size of the pupil. The sphincter papillae are innervated by fibers from the oculomotor nerve. 3. Parasympathetic. Is an abnormal increase in intraocular pressure that results when the rate of production of aqueous humor exceeds its rate of removal. Glaucoma. The ligaments connect the lens capsule to the ciliary body. Suspensory. The lens is part of the system of the eye. Focusing. The most common type of gigantism, pituitary gigantism, results from excess secretion of growth hormone. The parathyroid glands are usually embedded in the part of each lobe of the thyroid gland. Posterior. A spinal is the removal of CSF from the subarachnoid space. TAP. The is in overall control of the autonomic nervous system. Hypothalamus. Stretch receptors, in the walls of large arteries near the heart detect changes in blood pressure. Baroreceptors. Cholinergic receptors are receptors to which binds acetylcholine. The parasympathetic division of the ANS is sometimes called the division. Craniosacral. Damage to the median nerve occurs most commonly where it enters the wrist through the carpal tunnel. The term funny bone or crazy bone is associated with the nerve. Ulnar. Wrist drop is major due to a damage to the nerve. Radial. The largest peripheral nerve in the human body is the nerve. Sciatic. The phrenic nerve is involved in breathing due to its innervation of the diaphragm. The brachial plexus originates from spinal nerve C5 to T1. A is the area of skin supplied with sensory innervation by a pair of spinal nerves. Dermatome. The nerves supplied to the upper limbs originate from plexus. Brachial. There are pairs of spinal nerve. 31. The trigeminal nerve, V, has 3 branches, ophthalmic, and mandibular. Maxillary. The main blood supply to the CNS include the vertebral and basilar systems of arteries. Internal carotid. Is a condition that results from partial or complete block of ventricles of the brain. Hydrocephalus. The neuroepithelial cells lining the neural tube are of simple type. Columnar. Is the caudal portion of the rhombencephalon. Myelencephalon. During brain development, nerves of the bronchial arches become the nerves. Cranial. The thymus produces which is involved in the development of the immune system. Thymosin. The kidneys secrete a hormone in response to reduced oxygen levels in the kidney. The hormone is called erythropoietin. Is sometimes called the hormone of darkness because its production increases in the dark. Melatonin. The exocrine gland of the pancreas secretes enzymes. Digestive. Is a chronic enlargement of the thyroid gland not due to a tumor. Goitre. Lack of in the diet can result in decreased thyroid hormone levels. Iodine. The posterior lobe of pituitary gland is also called Neurohypophysis. In the retina, cells in the inner plexiform layer synapse with bipolar and ganglion cells. Amacrine. The are movable folds covering the anterior surface of the eye when closed. Eyelids. The organs of hearing and balance are divided into three parts, the external, and inner ear. Middle. Is a complete loss of smell. Anosmia.